Hey everyone, PT Channel here to talk about some shoulder rehabilitation for post-surgical, pre-surgical, after shoulder surgery, injury, prevention, just general conditioning of the shoulder, some stretches, some flexibility stuff before you get out on the sports, throwing, something there, general conditioning as well. So first I like to use is some range of motion first. Get it stretched out, post-surgical wise, a little active assisted range of motion. So if you're a student out there, you're a therapist, or you're a patient, this would be important to know the form and the function of these, very important to have here. So I use a golf club. You can use a T-bar, a band, a broomstick, an umbrella, something that's going to have some stability to it on there too. You can use a cane also. Now I use here, got the golf club. So this one, first one you're going to do is arms nice and straight. So you bring her up, hold, 1, 2, 3, and then bring her down slow and controlled. You can do these laying down, but for the sake of our video, we're just going to do it standing up so we can go from other ones over there. 1, 2, 3, hold for that 3 seconds. Up and over on there too. Slow and controlled. Now you might not even go to here, and that's okay. Just slow and controlled, bring it down. No pain, no irritation. You should be able to smile and breathe at the same time, making sure you're okay with that. Then you can use these for shoulder patients, back patients, neck patients, upper thoracic patients. Just kind of get some good general mobility on there. General mobility. Exhale at the top. Always breathing, smiling. 1, 2, 3. Hold for that 3 seconds at the top, very important. Do about 10, 3 sets of 10 on there, take a break after each 10 you do. Okay, so this is shoulder flexion, very important, active assisted. Next one is going to be active assisted abduction. So you're going to bring her out to the side, a little stretch, 1, 2, 3, and then bring her down slow and controlled. Important to keep that arm nice and straight, bring her down slow and controlled, very important. These are good for shoulder impingement, rotator cuff, post-surgical shoulder patients as well, so very important there too. So again, 3 seconds at the top, 3 sets of 10, active assisted range of motion with the T-bar, cane, broomstick, umbrella, golf club. Alright, so you got the abduction to the side. Next one is external rotation, very important too. That's why I like the golf club, because it's got the rounded thing where you can hold. A cane would be the same kind of thing, which would be good. But you can hold on here. Keep your elbow tucked by your side, start on your stomach so you can choke up on the cane or the golf club, whatever you're using, wherever you feel comfortable with, and kind of pull it to your stomach, and then bring her back, this motion right here. What a lot of people do is they keep her down here and they bring her that way. That's a lot of elbow, not as much shoulder. Up here it's all shoulder, external rotation, stretching out the shoulder rotator cuff muscles. Now I like to equate this to a microphone. If you're singing in a microphone, they can hear you here. So you want to make sure that it's tucked up nice and high, just like that nice angle is. So it's this angle right here. This angle, very important. Not down here. You don't want this angle. Very sloppy, getting elbow range of motion. It's not really important, improving our shoulder. Patients do that all the time. They feel like they're getting better that way. So again, 3 second hold, 3 sets of 10. Maybe work on it a bunch at home, couple times at home, 3 or 4 times at home if you're recovering from surgery on there. So you got the review, up and over flexion, abduction, and external rotation with the cane. Very important to work those out with the broomstick, cane, golf club. We're going to do some isometrics here with this ball next, okay? We got a ball, you can use a pillow, fold it in half, but I got this exercise ball, very important to have something with a little resistance on there too. If you use a pillow, fold it in half, don't use some little small guy that's not going to give you any resistance, okay? So we'll show you a couple rotator cuff exercises, some strengthening the general shoulder mobility, strengthening that as well. First one, since I got you right here, is very important to have, is the internal rotation ball squeeze on there too. You can get a little grip with it, you can squeeze with your hands, 1, 2, 3. After shoulder surgery, you want to work that grip and that forearm strengthening as well as the elbow, because it's safe to do. You don't want to tighten that up on there as well. So you want to just do a little ball squeeze. The first thing you don't want to do is keep your elbows like this. This is going to work a lot of pec, internal rotation. That can cause a little irritation and pulling in there too. And we want to work the rotator cuff, subscapularis muscle, the internal rotator. So we keep our elbows bent at 90 degrees, elbows by our sides, little ball squeeze, 1, 2, 3, hold for 10 seconds, 10 times. Some people do 5 to 6 second holds. I just do 10 for 10 because it's easy to remember. 10 seconds, 10 times, And we'll do about 2 sets of those. So a little internal rotation ball squeeze. Just like that. Again, you can use a pillow if you don't have one of these. The next one we're going to do is a shoulder flexion. We did the ball squeeze. Next we're going to do is the shoulder flexion. Okay, so you're going to use a wall and the ball here. You can use a pillow again. Fold that in half if you need to. But first we're going to do bent elbow. Very important. Don't have it out by your side. See that space in there? We don't want that. We want to keep it tucked by our side like that too. We're going to hold again. Always are going to be 10-second hold 10 times. Hold 1, 2, 3, about 10 seconds, just like that, and relax. Now we're not really pushing, going to pop it, going to do anything like that too. Just a sub-maximal, no pain. You shouldn't feel any pain in the front of the bicep or the front deltoid or the tendon insertion in there. No pain. And as anything, no pain at all with any of these, okay? 10 seconds, 10 times, just like that. I'm going to abbreviate the motion just for the sake of the video. But okay, I'm going to flip around too as well. You would do the same shoulder, you don't do the opposite shoulder, but you're going to do shoulder extension, okay? Very important to hold 10 seconds, 10 times as well. And the big thing too is you're not really pushing hard, you're just getting a little contraction in there. You're going to get that muscle to fire in that deltoid, that posterior deltoid there too. Works shoulder extension, very important. And also, you can do a little shoulder squeeze where you pinch your shoulder blades together. 2, 3, we call this a no money, where you have your palms here, and you do a little push into it. 1, 2, 3. So that's a little combination exercise. But if you got rid of the ball, you can put the ball in the center of your back and do a little squeeze on the ball. 1, 2, 3, like that too. Put it up a little higher for me. But you put it right between your shoulder blades, get a little pinch. 1, 2, 3. Got a little no money exercise because it's like you're pulling your pockets apart, no money. Yeah. So 1, 2, 3, 3-second hold that way. I like the 3 to 5-second hold that with that one. Just good posture check, very important. You want to avoid that rounded shoulders, forward head posture. That's a good way to do that. So you got the ball, got that one. The next one you can do is external rotation. These are higher level ones if you're recovering from a surgery. Wait, you want to wait, until you go ahead by your therapist or your doctor. But for these internal external rotation ones, you got to be careful of that to make sure you're clear to do this one. Okay, so this one is you're rotating into the ball and you're holding again 10 seconds, 10 times. Now you don't want is the elbow to come out the side and push that way. See that space in there? We don't want that. You want to keep that elbow tucked. So you're basically having here and you're going out with your hand. So you're starting right here and going out. So you're gently pushing the ball, 10 seconds, 10 times. Again, you have the ball squeeze for internal rotation. This is external rotation. The next one is a shoulder abduction, abduction. So you're here and you're pushing it out to the side. Again, you don't want to be out like that. You don't want sloppy form, always good form. 10 seconds, 10 times, 2 sets of those as with all of them. So you're going to hold 10 seconds. And always breathing, smiling, good posture, shoulder blades back, good posture, get that shoulder blade in good position. It's very important after surgery and shoulder rehab. So you got that one. The next one is you put it by your side and you push here. And you hold it bent elbow. You don't want to come across like that. You want to keep it here and you're just squeezing across. So you're basically coming in, squeezing like that, keeping your elbow nice and straight for 10 seconds, 10 times, 2 sets again. Alright, that's it. Shoulder isometrics with little scapular squeeze and ball squeeze. Push your isometrics. To review, 10 seconds, 10 times. Some might tell you 5 to 6, but I like 10 for 10. 2 sets, so you take a break after each 10 you do, and you want to try those 2 to 3 times a day, especially when you're not going to therapy. This is a good home component over there if you're recovering from shoulder surgery, if your therapist gives it to you or not.